As an association, we were never consulted when this bill was being drafted. And you know, our laws are very clear that any law that is being made must undertake stakeholder participation. So we never were party to this bill. And therefore, what we have is a bill that went through some backdoors.
It's no time to experiment on Kenyans anymore. Since the introduction of Veterinary Medicines Directorate, we've seen actually cases of misuse of veterinary drugs come down. Secondly, we've seen countries interested in importing products from Kenya because of the mechanisms that the Veterinary Medicines Directorate has put in, so that because you can now assure of safety, you can now assure of withdrawal. You cannot be able to monitor drugs which you do not have expertise on. And if we are not careful to roll back these gains that we have done as a country through this bill which has been introduced in Parliament, this is a warning, and this is a warning from us as practitioners. It will not be business as usual. The next pandemics, it will be worse than the COVID-19.
Veterinary medicines must be regulated by the competent authority. That means we prepare them ourselves, we use them ourselves, we monitor the residues, and then we assure that the food is safe, because those residues will be associated with so many other effects, like antimicrobial resistance, where organisms, when exposed to those drugs, develop resistance. And we are the only authority that can be able to cope with that, to ensure that the food is safe.
In 2015, we made it clear that we wanted to properly regulate these drugs, and we developed regulations, the veterinary medicines regulations, that created a veterinary medicines directorate. And that is an agency of the government that is solely dedicated to regulation of veterinary medicine. So our appeal again is to members of parliament to think about Kenyans and the safety and Vision 2030. We need healthy people.